People at Work. The Nurse, a Ladybird book, first published in 1963. A nurse's job is to look after people who are ill. Hospitals are full of sick people who need special care to help them to get better. These sick people are called patients. Many nurses work in hospitals taking care of the patients. Doctors in the hospitals find out about the patients' illnesses. Then the doctors tell the nurses what to do to help the patients to get better. The nurses carry out the doctor's orders and care for the patients until they are well enough to go home. Patients who stay in hospitals sleep in wards. A ward is a long room with many beds along each side. In the middle of the ward there are often tables with vases of flowers on them. Beside each bed there is a locker. This locker has a drawer and a cupboard in which a patient can keep things. Sometimes there is a set of headphones behind each bed so that the patients can listen to the radio when they wish. At first, patients usually stay in bed all the time. The doctor visits them every day. He talks to the nurse in charge of the ward and tells her what treatment to give the patients. The nurse who is in charge of a ward is called the sister. When a patient begins to get better, he may get up for part of the day. Then he can sit in an armchair or walk about the ward and talk to other patients who are still in bed. All day and all night there are nurses in the ward to look after the patients. It is the sister's job to see that the patients are given the proper food and medicine to help them get well again. Nurses wear different uniforms in different hospitals. Often they wear blue dresses, white caps, and white aprons. The sister wears a different uniform from that of a nurse. Usually it is dark blue dress, a small white apron, and a smaller cap than the nurse wears. The nurses are always busy. Early in the morning they give the patients cups of tea. Then they help the patients to wash before breakfast. Most of the patients are given breakfast in bed. After breakfast, the beds are made and the wards are cleaned. The nurses give the patients the medicines and tablets which they need. In hospitals, patients go to sleep very early at night. The last job of the day, nurses, is to see that all the patients are ready for sleep. When the day nurses go off duty, the night nurse is left in charge. The night nurse stays awake all night to look after the patients. She often walks around the ward to see if the patients are asleep. If someone is awake, the nurse gives him a drink or anything else he needs. Sometimes the night nurse sits at a table from which she can see all the patients. If it becomes cold during the night, the nurse can wrap her big cloak around her. Most hospitals have visiting days 2 or 3 times a week. Then the patients' relatives and friends come to visit them. The patients look forward to visiting days very much. The visitors often bring flowers, fruit, and books for the patients. The visitors sit beside the patient's bed and talk to them and cheer them up. At the end of visiting time, a nurse rings a bell to tell the visitors to leave. When the visitors have gone, the nurses arrange all the fresh flowers in vases. Nurses in a hospital work very hard. Although the nurses may sometimes feel tired, they are always cheerful and smiling. When they are learning to become nurses, they have to read books and take examinations. Many nurses do not live at home. They live together, near the hospital, in large houses called nurses' homes. Each nurse has a room of her own in which she sleeps and reads. And there are also large sitting rooms where the nurses can talk to each other and sit and watch television. Some wards in hospitals are kept for mothers with new babies. In these wards, the nurses are always very busy, but they enjoy their work because they like looking after young babies. Newborn babies need a lot of care. The nurses help the mothers to take care of their babies. The nurses weigh the babies, bath them, and change their clothes. Everyone is pleased when a new baby is born. Friends often send flowers and cards. Fathers enjoy visiting the hospital to see the mothers and their new babies. At night, all the babies sleep in the baby nursery. Each baby lies in its own cot. Nurses stay there in case the babies cry. All the new babies look very much alike. Nurses must make sure that the babies do not get mixed. Every baby has its name on a necklace of beads around its neck and on a bracelet around its wrist. The beads and bracelets have letters on them to spell the name. When the babies need to be fed, the nurse takes them to their mothers. Many patients are taken to hospital by ambulance. An ambulance is a special van to carry people who are ill. There are stretchers inside the ambulance so the patients can lie down. Ambulance men can carry a stretcher in and out of the van without disturbing the patient. The windows of the ambulance are made of special dark glass. People inside the ambulance can see out, but no one can see in. Some people are taken to hospital because they've been hurt in accidents. When a person has been badly hurt in an accident, someone can telephone for an ambulance. After a road accident, the police often do this. At all times of the day and night, ambulances are ready to take people to hospitals. Many ambulances are fitted with radio telephones. They can then be sent quickly to the places where they are needed. When the ambulance arrives after an accident, the ambulance men lift the injured person onto a stretcher. They then slide the stretcher gently into the ambulance. One ambulance man or a nurse sits in the van beside the injured person. The driver then drives to hospital as quickly as he can. He can use his bell or his flashing light to tell other traffic to keep out of the way. At the hospital, the ambulance is driven to the door of the casualty department. Here, doctors and nurses are always on duty, ready to help people who have had accidents. If the person is badly hurt, the ambulance man carry him into the casualty department on a stretcher. If he is only slightly hurt, the ambulance man may take him inside in a wheelchair. A doctor examines the injured person at once. If he is badly hurt, the doctor will want him to stay in hospital. A nurse will help the patient into bed and look after him. People do not always go to the casualty department by ambulance. If they have had small accidents, they can go to the casualty department of a hospital by themselves. Sometimes accidents happen in the school playground. If a girl falls and hurts her arm or leg, she can be sent to the casualty department. If the doctor finds that the arm or leg is broken, A nurse will help to put it in plaster. The child will then be sent home. A large hospital usually has a special room called an X-ray room. Here there are X-ray machines which take photographs of people's bones. When someone has hurt a leg or an arm, the doctor may want to see an X-ray photograph. The photograph will be developed quickly and the doctor will be able to see if any bone is broken. An X-ray machine can also be used to take photographs of a person's chest, lungs, stomach, or head. Sometimes a person who is ill needs to have an operation to make him better. Most big hospitals have operating theatres where the doctors carry out operations. Nurses help the doctors. The patient does not know anything about what happens in the operating theatre. He is given an anaesthetic, which makes him fall asleep. Then he is put on a trolley and taken to the operating theatre. When the patient wakes up again, he's in bed, in the ward, and the operation is over. Another department in the hospital is called the Outpatients department. Some people who are ill do not need to stay in hospital. They can visit the Outpatients department, where doctors and nurses will give them the treatment that they need. Some patients travel to the Outpatients department of the hospital by themselves. Other patients are not well enough to do this. They can travel on a special little ambulance bus. The bus comes to people's houses to collect them. Some wards in hospital are kept for children. Children's wards are happy places. Even though the children are ill, they enjoy staying in hospital until they are better. No one is lonely in the children's ward. The children enjoy talking to one another. The nurses are kind and smiling. The food is just the kind which children like. Often there is ice cream and jelly. The children think it's fun to eat their meals in bed. There are always lots of toys in a children's hospital. Those children who are able to walk about play games with the children who are in bed. There are always many interesting storybooks in the ward. There are picture books for the youngest children and plenty of comics. Sometimes there are big toys such as a doll's house, a rocking horse or an engine. And when the nurses have finished their work, they enjoy playing with the children. Sometimes the hospital has a teacher who visits the children's ward every day. The teacher takes lessons with the children who are not in bed. Sometimes all the children have a singing lesson together. Then the teacher sits beside each child who is in bed and helps him with his reading, writing and sums. She leaves the child some work to do in bed. Next day she marks the work. The children like having to do lessons to do in bed. Children who are in hospital at Christmas have a wonderful time. A week before Christmas, the ward is decorated with streamers and balloons. Each ward has a lovely Christmas tree with presents on it. On Christmas Eve, after the lights are put out, the children are told to listen for the carol singers. All the nurses walk into the ward carrying little lamps. Then they sing Christmas carols for the children. On Christmas morning, every child looks in the stocking which is hanging at the end of the bed. All the stockings are full of presents. The children enjoy a very good Christmas dinner of turkey and Christmas pudding. They eat nuts and fruits, they pull crackers and wear paper hats. After dinner, Father Christmas visits the wards and gives every child a present from the Christmas tree. Christmas in hospital is great fun for the children. When a child is beginning to get better, the doctor says he can get up for an hour or two every day. Then, when the child is quite well, he can go home again. His mother and father come to the hospital to take him home. He's pleased to be going home, but sorry to leave his friends in the children's ward. Mother and father are glad the doctors and nurses in hospital have made their little boy or girl well again.